Bismillahirrahmanirrahim. Rabbi zidni ilma. Keep your eyes on the stars and your feet on the ground. Assalamu alaikum everyone. My name is Dr. Sadia Rafi and under the supervision of Professor Dr. Sarah Afzal, today my topic of presentation is Chlamydia. Learning outlines include the introduction, epidemiological determinants, mode of transmission, clinical presentations, levels of preventions, recent updates, and multiple choice questions. Learning outcome. At the end of this presentation, participants will be able to describe chlamydia, its epidemiological triad, and prevention and control. Talking about the sexually transmitted disease and a bacterial infection, chlamydia is one of them. The other famous you know as well are the syphilis and the gonorrhea as well. Introduction. Chlamydia is a common STD, sexually transmitted disease that can infect both men and women. It can cause serious permanent damage to the women's reproductive system and can cause from infertility to fatal ectopic pregnancy. It can cause sterility in men. History. Chlamydia first became recognized as a specific sexually transmitted infection in 1970s, but it took until 1988 for it to become notifiable. Prevalence. Chlamydia is the most frequently reported bacterial sexually transmitted infection in the United States. 2/3 of the new chlamydia infections occur among youth aged 15 to 24 years. Spread. By having vaginal, anal, or oral sex with someone having chlamydia, if someone has it and was treated in the past, can still get infected again. Pregnant women can transmit it to the baby during childbirth. Talking about the biological triad, agent, which is Chlamydia trachomatis, gram-negative bacteria, obligate intracellular bacteria, and lives in the cytoplasm of the epithelial cells. Chain of transmission, reservoir is human. Risk factors include the adolescence, new or multiple sex partners, history of sexually transmitted disease infections, presence of another STD, and lack of variant contraception. Its risk factors are cervical ectopy, multiple partners, existing STDs, men having sex with men, unprotected sex, and HIV positive. Transmission. Transmission is sexual or vertical. Highly transmissible. Incubation period is 7 to 21 days. Significant asymptomatic reservoir exists in the population. Reinfection is common. Perinatal transmission results in neonatal conjunctivitis in 30 to 50% of exposed babies. Clinical features include the most people who have chlamydia have no symptoms. If have symptoms, they may not appear until several weeks. Even when chlamydia causes no symptoms, it can damage the reproductive system. The symptoms in men and women: in men, penile discharge, burning or painful urination, and testicular swelling, whereas in women it is vaginal discharge, burning and painful urination, and bleeding between periods. If we see the difference between both services, at the right under this side, left side is the normal service, so it's soft glistening, whereas in chlamydia cervicitis, it is all at the level of internal organ, it's all red and with the discharge. Clinical syndromes caused by chlamydia trachomatis. In men, women, and infants, there is local infection, then there is a complication, sometimes there's sequel. So in men, local infection is conjunctivitis, urethritis, prostatitis. Complication is Ritter syndrome, the epididymitis. The Ritter syndrome is that the triangular syndrome, which includes the conjunctivitis, urethritis, and third is arthritis. So this is called Ritter syndromes. Like this, females also have conjunctivitis, urethritis, cervicidal proctitis, endometritis, salpingitis, including the female reproductive system and as well as the Ritter syndromes. And the sequel could be infertility, ectopic pregnancies, chronic pelvic pain, and chronic arthritis. And in infants, it may lead to conjunctivitis, pneumonitis, and complication could be lung disease, and it's rare if any sequel. Untreated chlamydia may increase a person's chances of acquiring or transmitting HIV. Levels of prevention. Primary prevention include the health promotion and specific protection. Our health promotion includes 3 strategic areas. Number 1, promoting public health policy, then promoting a supportive environment, and third is strengthening community action. Promoting healthy behavior, personal behavior skills like providing information, education, and counseling, orienting health services towards meeting all the patient needs, then the specific health education programs regarding safe sex, using condoms, reporting for early treatment, and strict compliance. All these factors further prevent the transmission of disease. Specific protection. There is no vaccine is available. For the first time, a vaccine against chlamydia has completed a clinical phase 1 trial. Secondary prevention includes early diagnosis and prompt treatment. Diagnosis is by number one is culture and second is non-culture test, which includes NATS, which is nucleic acid amplification test, non-nucleic acid amplification test, and serology. The culture is the gold standard historically. Variable sensitivity from 50 to 80% is highly specific, used in legal investigations, and not suitable for widespread screening. Non-culture, as I talked to you about this, these are nucleic acid, NATs, non-NATs, and serology. NATs are the most sensitive test and can be performed in easily obtainable specimens such as vaginal swabs or urine. Urine is a specimen of choice for men. NATs have demonstrated improved sensitivity and specificity compared with cultures for the detection of Chlamydia trachomatis at non-genital sites. Treatment. Chlamydia can easily be cured with antibiotics. HIV positive person with chlamydia should receive the same treatment as those who are negative. Person with chlamydia should abstain from sexual activity for 7 days after single dose antibiotics or until completion of a 7-day course of antibiotics to prevent spreading of infections with partners. Although medication will cure the infection, it will not repair any permanent damage done by the disease. The infection in infants can also be treated with antibiotics. So these are the different regimes, treatment lines which are given by CDC. In the adults, among adolescent and adults, doxycycline 100 milligram orally 2 times per day for 7 days, or alternative is azithromycin 1 gram orally in a single dose. Next come during pregnancy, same azithromycin 1 gram orally in a single dose, or alternatively amoxicillin 500 grams 3 times for 7 days. Then again for the neonates is the erythromycin or ethiasuccinate according to body weight. Infants again azithromycin or erythromycin according to their body weight divided into 4 doses for 14 days. In infant and children, so there are different regimes for this, because they are best treated with antibiotics. Next comes the repeat testing after treatment. This is also called as test of cure. So in pregnant women, repeat testing preferred by culture 3 weeks after completion of recommended therapy. And in non-pregnant women, screen 3 to 4 months after treatment, especially adolescents. EPT, which is expedited partner therapy. To help get partners treated quickly, healthcare providers can give infected individuals extra medicine or prescriptions to give to their partners. This is called expedited partner therapy or EPT. This is the treatment which is given to the patient's partners, recommended by CTC, in which I'm just targeting chlamydia infection. The preferred is doxycycline 100 mg orally twice daily for 7 days, or azithromycin 1 gram orally for 1 dose, and safe in pregnancy, azithromycin 1 gram orally for 1 dose. Why to screen? Screening can reduce the incidence of pelvic inflammatory disease by more than 50%. Most infections are basically asymptomatic, and screening decreases the prevalence of infection in the population and reduces the transmission of disease. Screening recommendation in non-pregnant women. Sexually active women aged 25 years or under should be screened annually. Repeat screening of women 3 to 4 months after treatment for the infection, especially in the adolescents. In cases of screening in pregnant women, screen all pregnant women at the first prenatal visit. A pregnant woman aged 25 years and those are at increased risk of chlamydia should be screened again in the third trimester. Partner management. Sex partners should be evaluated, tested, and treated if they had sexual contact with the patient within 60 days preceding the onset of symptoms or diagnosis of chlamydia. Prevention counseling. Risk reduction. The clinician should assess the patient's behavior change potential, discuss prevention strategies like abstinence, monogamy, condoms, limit number of sex partners, etc. Develop individualized risk reduction plans. So if we summarize chlamydia, how it is transmitted, it is by unprotected sex, what are the symptoms, inflamed rectum, inflamed eyes, urethra discharge. The treatment is by swab or urine test from the healthcare facility. When to test people 25 or younger once yearly, and if at a high risk, then after treatment, definitely after that. Then the treatment is prescribed by the healthcare professional, and these are the antibiotics, and it is well treated with the antibiotics. Moving towards recent updates. National AIDS Control Program of Pakistan. National AIDS Control Program was established in 1986 to 87 with the focus of diagnosis of case that comes to hospital but progressively began to shift towards a community focus. So different NGOs and global funding was done, public-private partnership was done in Pakistan regarding this aid program. The few main objectives of National AIDS Control Program are prevention of HIV transmission, safe blood transfusion, reduction of sexually transmitted infections transmission, and establishment of surveillance. Basically, there is no separate program of the STIs in Pakistan, and it is being covered in the National AIDS Control Program. So it is one of its objectives. According to WHO, Global HIV, Hepatitis and Sexually Transmitted Infections Program, in the 75th World Health Assembly, Global Health Strategies on respectively HIV, hepatitis, and infection for period 2022 to 2023 is approved, and its implementation is for next 8 years. So the main strategies and the purpose is to end all these infections by year 2030. One of the information is call us Delhi to get chlamydia, how these marsupials could help human battle the STI. In koalas, chlamydia's ravages are extreme, leading severe inflammation, massive cysts, and scarring of the reproductive tract. Because of these similarities, trials may be valuable clues for researchers across the globe for developing a human vaccine. Moving towards the multiple choice questions. Among all STIs, chlamydia is the most common one. The highest number of cases are found in WHO region of America and WHO Western Pacific region, which our age group has the highest rate of chlamydial infections. 15 to 19 years old, 20 to 25 years, 25 to 29, 30 to 40 or 40 plus years old.
B.
Yes, B is the correct answer, 20 to 24 years old. Chlamydia score, the silent disease record is often goes undetected. What portion of infected men and women have symptoms of chlamydia? 1 in 2 men and 4 in 5, 3 in 10 men and 1 in 2, 1 in 10 men and 3 in 10 women, 5 in 100 men and 1 in 10 women, 4 in 100 men and 5 in 50 women. How many are symptomatic? Have infection?
B.
No, it's C. It's 1 in 10 men and 3 in 10 women would be symptomatic. Chlamydia is one of the major pathogens that cause sexually transmitted diseases, which are the most common symptoms of the disease that can occur both in men and women. Diarrhea and vomiting, mouth ulcer and sores, flu-like symptoms with high-grade fever, painful urination, and with abnormal discharge of vertigo. B is the correct answer. Painful urination with abnormal discharge. 29 years old women come to your clinic with positive culture report showing chlamydia infection. As your clinician's knowledge, which of the following antibiotics are most prescribed for the treatment of chlamydia infection? Rifampicin and isoniazid, metronidazole, doxycycline, or azithromycin, ciprofloxacin, or ceftriaxone, or paracetamol?
C.
Yes, C is the correct answer. As a senior clinician, ABC teaching his junior residents that in the treatment of any disease, diagnosis is a pivotal role. Which of the following is a common specimen used for the diagnosis of sexually transmitted chlamydia infections that occur in both men and women? Oral swab, cerebrospinal fluid, urine, skin biopsy, or blood? C. C. Urine. Patient in third trimester of pregnancy comes to a clinic with chlamydia infection. As a doctor, you are counseling her about chlamydia trachomatis, which is transmitted from the infected mother to baby through birth canal, can cause neonatal conjunctivitis. After how many days the symptoms start to develop in life? After 6 hours, 24 hours, 48 hours, 48 days, or within 17 to 15 days? E is the correct option, within 7 to 15 days. Chlamydia infection in females causes pelvic inflammatory disease, which literally destroys female reproductive organ. Which of the following syndrome is most associated with complications of pelvic inflammatory disease caused by Chlamydia trachomatis? Blue baby syndrome, Fitz-Hugh-Curtis syndrome, toxic shock syndrome, leaky gut, or Luther syndrome? The correct option in this, the correct option is Fitz-Hugh-Curtis syndrome. It is iconic, basically, with the pelvic inflammatory disease caused by chlamydia infection. It is the basically infection of the outer layer of liver. A vaginal swab specimen was taken from a 23 years old patient with symptoms of painful urination. A body diagnosis of the chlamydia pathogen was performed. Which of the following method is not used for the isolation of chlamydia infection? Venereal disease research laboratory test, direct microscopic examination by using gram stain, agar, culture plate method, or nucleic acid amplification test?
B.
No, the correct answer is A. First one is used for the syphilis, remaining three are used for chlamydia. Chlamydia infection is known to have a high frequency of transmission. If one partner is infected, what is the likelihood that the other partner will also be infected? 10%, 25%, 50%, 75%, 100%.
A.
The correct option is D, 75%. A 30 years old sexually active woman has had a mucopurulent vagina discharge for 1 week on pelvic examination. The cervix is reddened around the os. A pap smear shows numerous neutrophils but no dysplastic cells. Which of the following infection disease is most likely to produce these findings? Candida albicans, Gardnerella vaginalis, Chlamydia trachomatis, human papillomavirus, or Trichomonas vaginalis?
C.
Yes, the correct option is C. This is my key. This is the YouTube link, and thank you so much. Any questions? Thank you so much.
Thank you.